That number on your blood pressure monitor? It could be quietly setting you up for a heart attack or stroke. Hypertension affects 1 in 3 adults globally, yet half don't even know they have it. Today we're exposing this silent killer and how to beat it. Hypertension, causes, prevention, and control. Hypertension occurs when your blood pushes too hard against artery walls. There are two main types: primary, also known as essential hypertension, which develops gradually over years and is caused by a mix of lifestyle and genetics with no single identifiable cause. And then there's secondary hypertension, which has a sudden onset and is caused by underlying conditions such as kidney disease, thyroid problems, obstructive sleep apnea, and certain medications. These factors dramatically increase your risk: family history, age, especially after 45, obesity, a sedentary lifestyle, a high-sodium diet, chronic stress, and excessive alcohol consumption. The good news? Up to 80% of hypertension cases are preventable. Here's your action plan. Lifestyle defense strategies. Follow the DASH diet, which is rich in fruits, veggies, and low-fat dairy. Reduce sodium intake, aiming for less than 1,500 milligrams daily. Engage in regular cardio, like 150 minutes per week of brisk walking. Manage your weight, as losing just 5 to 10 pounds can help. Reduce stress through meditation and deep breathing. Limit alcohol to a maximum of 1 drink per day for women and 2 for men. And finally, quit smoking, since nicotine raises blood pressure for hours. CDC warning: only 1 in 4 adults with hypertension have it under control. Don't be a statistic. While there's no cure, hypertension can be effectively controlled through medical management. This includes lifestyle changes, which are the first line of treatment for stage 1 hypertension. There are also various medications, such as ACE inhibitors, calcium channel blockers, diuretics, and beta blockers. Regular monitoring like home blood pressure checks and doctor visits is crucial. Hypertensive crisis symptoms, which occur when blood pressure is over 180/120, include severe headache, nosebleeds, vision changes, chest pain, and difficulty breathing. These symptoms require immediate medical attention. Hypertension doesn't have to be a life sentence. Get checked regularly, make these lifestyle changes, and take control of your heart health today. Your future self will thank you. Know your numbers. Download your free blood pressure log sheet today.